Good morning from WKYT News. I'm Bill Bryant, and we welcome you to Kentucky Newsmakers. Later, Kentucky Transportation Secretary Jim Gray will join us. We'll talk about all the construction going on and the plans for Kentucky roads. But first, the Lexington-Fayette County Health Commissioner Dr. Mille is here. It's back to school time. We're headed toward flu season. Also, some uptick in COVID numbers out there. There remain concerns also about the measles. But along with some concerns, health leaders also hope to emphasize preventative care and actions that can help all of us be healthier versions of ourselves. The health department says its mission is helping Lexington be well. Dr. Mille is joining us. Thanks for coming. We appreciate you being here.
Thanks for having me.
And congratulations on your selection as a Fayette County Health Commissioner, although it comes after a long time for you in public health, and this is sort of an anniversary for you were telling me.
It is. Today is my 19th, starting my 19th year in local public health.
So you've been at it a while.
Yeah.
You were at WKYT, the health district just north and east of here. How are you settling into your new duties?
I am. It has been 8 very fast weeks. I'm in the learning and assessing stage, so learning a lot about there's a saying in local public health that if you've seen one health department, you've seen one health department, and that is true in the sense that the health department takes the shape of the community in a lot of ways, and it should. And so the work that I did over in WKYT, a lot of it applies, and I bring that with me, but also learning the resources that we have here in Fayette County, the partnerships that are already there, what the team has been doing, and so I'm really learning a lot.
And I'm sure you're meeting the staff, and you have a good team, I assume.
We have about 180 people. We are spread across the entire community, so we have school health. Not every health department has school health, so that's a big portion of what we've kicked off in the first 8 weeks I've been there, is getting that staff up and running, and we have a strong school health team.
Well, let's dig right into it.
Okay.
Back to school, of course, does mean that those students are in close contact again. Do we typically see some increase in illnesses brought on by that simple fact?
Absolutely, yeah. You know, it's interesting because we are charged with protecting from a communicable disease standpoint, and so the important piece of that is having our school nurses in our schools and really being able to serve the kids. Some of the kids, you know, are there for some of them. That's really their comfort in having a school nurse, and our school nurses take great pride in that. So we expect to see lots of illness and sickness, and trying to figure out, is that the flu, is that COVID, is that just allergies, right? So having a nurse right there in the school is really beneficial.
Yeah. What is going on out there right now that is circulating that we're watching?
Well, in my 8 weeks, it has been interesting. We had the first week I was there, my staff kind of joke about, you know, I had the first case of COVID in 2020 in Harrison County, and the first week on the job here in Lexington, we had the first case of measles, and we had a few other things. We had the salmonella outbreak, and so you know, they joke about maybe that stuff is the communicable diseases are chasing me, but you know, COVID is not a reportable disease anymore, and so we're not seeing that landscape as quickly as we were 5 years ago, right? Because we've relaxed those. We know more about the disease, and so but we expect the flu to be starting to increase. Definitely the common cold, just because kids are around each other, and you know, we're in the schools talking about preventing just the simple things by washing your hands, right? It's the simple method of remember to wash your hands.
What are the current guidelines for flu and COVID vaccines?
Yeah, so obviously you would need to, they change so quickly, and so depending on where you are, you really need to work with your specific provider on determining when was your last dose of COVID. We're worried about pregnant women, immunocompromised. That's the real big population that we're worried about. And then obviously watching the strain of flu and making sure everybody knows to get your flu shot. So we've actually got 4 community-wide events coming up. And we'll share those on our website and on our Facebook page for the community, sharing all the ways, and I'm still learning about all the ways we share information, but we've got 4 flu vaccine events planned for the community to get free flu shots. So
that is important,
that.
and that's basically everybody. needs a flu
Absolutely.
shot. Virtually everybody,
Yes,
right?
yes. The more we can get, the better.
And then on COVID, again, it's not a one-size-fits-all recommendation any longer.
Right. It is not a one-size-fits-all. And obviously, we're worried about pregnant women, immunocompromised, people like that. Those are the people we want to really protect. Someone who's healthy is, it can still impact you, but the population we're really worried about protecting is that population.
Nobody saw the 2020 COVID pandemic coming. As you said, your health department was overseeing Harrison County, which had the first case in the state. We all remember that. We all did the best we could during that time. We all know it got political in strange ways here and there. Did we learn from that experience, do you think? Or were people so eager to move on that maybe some lessons were lost?
Yeah. It's tough. We were in it for a lot longer, and we know the attention span of all of us is very short, right? Anybody, I think you've got 7 seconds to get the attention, to keep the attention of someone. And so we were in that for a really long time, and people were obviously fatigued. One of the things that we are seeing that it's a challenge for us now is facing the vaccine hesitancy, because people saw the COVID vaccine roll out really quickly. And, people feel very strongly about their viewpoint on how was this created so quickly, and then depending on which side of that you're on. And so I think we have a lot more education to do and help people understand why vaccines are so important. We prevented measles 20 years ago, and it's back, right? Vaccines work, but it's difficult to get someone to get off their stance on that when they feel so strongly about it. So we've got a lot of work to do in marketing and educating people on what are vaccines and why are they important.
Has the landscape shifted under the Trump administration to the level that at the public health department you have to make different decisions?
Yes. So funding doesn't roll down as quickly as you would think in terms of funding cuts, and so we're hearing that, right, and we're looking at that, and so that usually our funding comes from the federal government to the state and then passed through locally to us. That is, we're hearing of those funding cuts, we're hearing of the Medicaid situation, and so we're going to pivot when we need to. Right now, we're really focused on still educating and making sure that the resources that we have, we're still pushing out there. And until, WIC is a good example of that, Women, Infant, Children. That's a program that we have, and so we are still enrolling people and moving the way we always have until we get notification that we need to change. So we're obviously concerned about funding from a public health standpoint. Anytime there's a change in administration, we one way or the other, we're ready to kind of assess and pivot, but right now we're just looking at that. We've not felt the effect of any cuts to our federal programs just yet.
There was you mentioned the salmonella outbreak in Lexington back in June that was traced to pies served at 2 businesses. Did that represent some good work in isolating that very quickly, really, and letting people know and tracking them down?
Absolutely. So that is, I say the blessing and the curse for public health is that if we're doing our job effectively, you will not know we're there. And this is an example of that. And so, we were able to trace it back to eggs, to a specific location. And so that's the strong public health work that you have here in Lexington with our epidemiologists and our environmentalists really getting into tracing back and how that comes to us as a complaint from someone who was sick, right? We have multiple complaints that people were experiencing the same symptoms, and we tracked it down to where have they eaten, where have they been, and so that's the epidemiology work that we do behind the scenes that the public doesn't necessarily see, that was one that was actually we needed to get out to the public, but there are several of those things that come through that our team is working on that oftentimes if it's not a public health risk, you won't hear about it.
But you're going to have to go from 0 to 80 quickly in a situation like that, right?
Absolutely.
Yeah. People often read the restaurant inspections to see how their favorite places do, or maybe how to avoid problems. How diligent is the health department in enforcing those food safety rules?
Yeah. So all of our environmentalists are trained. It takes about 2 years to get an environmentalist trained and really operating on their own. So 18 months to 2 years is really to get them very comfortable with every program that we have. And obviously the public is very interested in restaurant inspections, right? Because we all love to eat, and that's fun. And but we have they go through an extensive training. They have to pass multiple exams to get their RS. And so, it's really, from our standpoint, we try to look at it as a partnership. So when we go and we're going into a restaurant and doing a restaurant inspection, we talk to the restaurant about we're your insurance here, right? If we want to help you do all of these things right, so we all want restaurants open, right? And so that's really the stance we take. It's not, we don't like to be the enforcers, right? I mean, we do that obviously for non-compliance, but we really take the approach of this is a partnership with us. We're here to help you do the business you want to do and do it in a safe way for our residents.
You try to help them stay open.
Absolutely.
If you can.
Absolutely.
You mentioned the measles outbreak. It's killed a dozen people around the country. There have been some cases in Kentucky. Are we getting that behind us, or is this still something we need to be very aware of, something that was declared eradicated 25 years ago?
Absolutely. Yeah. It's a concern. I mean, this is just one example, right, of where we're headed with low vaccination rates. And so I think that's the message here is it's the work that we have to do is help educate people and bring them on board to considering vaccines and really talking to experts that know and have been in the landscape of the work with vaccines as pediatricians or providers just in general. And so that's the work that we have to do. But really, the measles case that we had, it was contained. Again, strong work of our epi team, it was contained to a family. And so the family was very compliant, wanted to be educated, wanted to talk through that. And so, but I think the message for the public is that we eradicated this 25 years ago. We've got to, what's the next one, right? So we've got some work to do to get in front of that.
We've seen some improvement in overdose and drug abuse numbers in recent years. Lexington does operate a needle exchange harm reduction program. Absolutely. It's been controversial at times. Is it effective in your view?
Absolutely. So the purpose for a harm reduction program is to identify disease and help people get resources to make better decisions. And so the exchange is the way that we do that. And so obviously we want to identify communicable diseases like hepatitis C and HIV. Hepatitis C is a very, very expensive and to treat, or has been in the past, and we've actually made some headway on that now where it's covered by Medicaid. And so it is we're working on revamping some of this internally. But in my previous work at WKYT, we could test and link them up to a primary care physician to go ahead and start treatment. And so I want to do that here in Lexington-Fayette. So part of it is we identify it, but then we don't want to lose those people, right? So we are doing some work on identifying disease always. That is a pillar for public health.
Any other goal that I haven't asked you about?
Gosh, so many. We'll be revamping for reaccreditation, which means we have a high level of excellence in the health department. We do that next year. Just really doing strong public health work across the city, building partnerships.
We appreciate you coming in.
All right,
thank you very much. Dr. Crystal Miller, now running the Fayette County Health Department. Stay with us. Jim Gray, the State Transportation Cabinet Secretary, is with us next on Kentucky Newsmakers. Welcome back to Kentucky Newsmakers. This has been a summer of major road construction in Kentucky. Work crews have scrambled to get projects done. Many drivers, though, have been frustrated by the long delays. We'll get an update on some of the ongoing work and future projects with our next guest, State Transportation Secretary Jim Gray. Recently, the state canceled nearly 2,000 driver's licenses amid ongoing state and federal investigations about how they were obtained. More EV charging stations have been announced along busy Kentucky roads as electric vehicle sales have been jumping. Will the end of incentives slow that trend? Secretary Gray is also a former Lexington mayor who was recently named to the UK Board of Trustees. Secretary Gray, thanks for coming. We appreciate it very much.
Great to be with you, Bill.
You're responsible for a lot of roads out there, aren't you?
A lot of roads. Well, think about it this way, Bill. The interstate system and our parkways were developed and created 75 years ago, more than 75 years ago. So there's a lot of repair and there's a lot of maintenance. And if you think about the scope of the projects, think of it this way. If we were to create this system today, it would cost us, where we've got 28,000 miles, for example, of miles of roads and 9,000 bridges in the state system alone, all right? It would cost close to $150 billion to recreate a system like that. And I think that number's really low, frankly. I've heard that number, but when I look at it and I think of what it's going to cost to build the Brent Spence Bridge or the I-69 bridge between Henderson and Evansville and the Mountain Parkway, when I think of those projects and what they're costing today, but we're getting them done. The governor said he wanted to get them done in this administration, and at least we're going to get those groundbreakings done.
So maintaining the roads is the priority. That I-75 repaving project has been a major. I know you have had the calls in Frankfort.
Yes, sir.
A lot of frustrations by people who have had extremely long wait times. We know safety is important, certainly. But were drivers given adequate notice about how disruptive that project is going to be this summer?
Well, you know, Bill, I always believe in continuous improvement. You know, wake up every morning thinking, how can we improve today what we did yesterday? Now, can we make improvements? Of course we can. That project, really challenging project, but did it need to be done? Yes, had to be done. Cracks in the pavement, fractures in the pavement, joints deteriorating. So the project has to be done. Now, the good news is that by the time you air this program, all 6 lanes will be open for the Labor Day weekend. So the section between exit 86 and 92 will have been completed. And the next section, the Richmond area, where it's the largest concentration of traffic as well. So the next section from 92 up to Clay's Ferry, that's next. That section is next. Now that will need to have through October to be completed. So
I know you've been asked, as we are being asked, you know, why not work around the clock?
Well,
would that, you know,
we have
speed things up?
We have been working. There have been several overnight work sessions. Now, it's not being done continuously because, frankly, it's not as effective a process at night, and it's a slower process at night. And so we felt like that it was better to do most of the work during the daylight hours.
And a lot of folks coming from that area into Lexington, they come to the Richmond Road, Athens-Boonesboro project, and that is another major delay, but also you say improvements to that road in the long term.
We've got the R-cuts, the R-cuts that are being developed on the Richmond Road section, 4 of them, maybe 5, and 1 has been completed at the entrance to the soccer stadium. That's what you're talking about, yes. Our R-cuts. You know, Bill, that crossover U-turn represents a really important safety feature. If you think about it this way, the traffic engineers will tell us that in a typical intersection, there are 32 conflict points. Typical signalized intersection, 32 conflict points. In an R-cut, half of that. All right, and think about it this way. When you're going across 2 lanes of traffic, you're having to look 2 lanes and then another 2 lanes. If you're having to look both ways. With an R-cut, you're looking in one direction. So it's a much safer feature. It's a much safer feature. And this is what really we're all about today, is how can we create a safer environment for our public, for our drivers. I get every morning, I know you're going to ask me another question, but I want to say this. Why am I so much more aware of this in this role today? The first email I get every morning is a fatality report on Kentucky's roads. And when I think then of how the cabinet focuses on safety and on these projects, and those projects being safe projects, creating safe projects, it's commendable in my view.
There will soon, in that regard, be speed cameras across the state.
Well, they're being tested now.
Yeah.
That's right. And it's really an improvement. Now, I know some folks are not going to like it, but think about it this way. It's for your own safety. It's for your own safety. Now, is it for the safety of the workers that are in these work zones? Yes, it is that as well. But often, where there are fatalities and injuries in work zones, and we had more than 1,000 work zone accidents last year, more than 1,000 in Kentucky alone. All right, and they sometimes involve the traveling public. It's not just the workers, but there have been fatalities while I've been on this watch, fatalities of workers in these work zones. So yes, we think it is a positive step forward, and bear in mind that there's going to be identification markers, there's going to be signage that tells you this is an enforced work zone, and tickets are not given automatically. They're having to be given by an officer at the site. That's the way the model is working.
But with that proof, with the camera. Secretary
with the camera.
Gray, there are federal and state investigations into how some drivers' licenses may have been illegally obtained outside the system. Governor Beshear says nearly 2,000 credentials were canceled as a result. You say that your cabinet has cooperated and worked to get out in front of this issue.
Bill, we take this very seriously. The issuance of credentials is a very serious process. So when this was detected and when it was confirmed, we immediately elevated it to law enforcement. Immediately elevated it to law enforcement. Those licenses that had been inappropriately issued were revoked. And the people who were suspected of wrongdoing were relieved, were terminated. They'd been hired through temporary agencies. They were terminated. Now, I can't say a lot about this because it is an ongoing investigation, and we've been asked not to comment about the details of it. But my belief is that those who have been involved in any wrongdoing will be held accountable.
Well, we will follow on that.
I will say this too, Bill, that it's not just in Kentucky that these schemes have been identified and reported and investigated in other states as well, from Oregon to New York to Connecticut, Florida, Texas. So when I use the word scheme, I think it's probably close to being correct.
The whole driver's licensing landscape has its controversy, and you have these regional offices.
Yes.
This summer, people have said they had difficulty getting appointments to get their real IDs or other credentials. Some say they would like to see the driver's licenses returned to the local county clerks.
Well, the circuit clerks actually asked the state to take it over. When the real IDs were first being issued, the circuit clerks asked the state to take it over, and the driver's licensing process as well. And what we did was we established first 17 regional offices. Then, now today, it's up to 35 regional offices. We've got about 400 employees working in these regional offices and issuing roughly 1.2 to 1.3 million credentials annually. Okay, so there's a lot of that work being done today. Now, think of it in terms of this. In terms of those long lines, May 8th was the deadline for Real ID enforcement. So we had a surge right up till May the 8th. We also had the 15-year-olds coming in for permits. That occurred at the very same time. So this surge really did have an impact on our lines, but we created new technology. We adopted new technology for line management. And today the wait times are in the 15 to 30 minute. Now it takes us 10 to 15 minutes to do a real ID transaction. So I know folks can be impatient about it. All we ask is that patience, but improvement is being worked on continuously.
All right, just got a little time left here. You recently announced some new EV charging stations. We know that EV sales are booming. The Trump administration, though, is removing some of the incentives for electric vehicles and says the free market should determine demand. Do you believe the trend toward electric vehicles, though, will continue?
Well, Bill, it's happening all over the world, and I suspect that we will not escape it. And we have already opened 5 stations. We've got 46 total planned. We have full funding for those 46 stations that we have planned today.
A few seconds left. You're now appointed to the University of Kentucky Board of Trustees. Certainly an honor, but a big responsibility. Does that signal to us that probably no more elective politics in the future?
Well, I can say this, that my commitment to this role at the university is something that I really, really, really look forward to.
Well, that didn't answer the second part of the question, but but I understand. All right.
You know how somebody's ever been a politician. What do they say? They never say never. Is that what they say?
Don't close the door.
Don't close the door.
Right.
But
Right.
I have enjoyed both being in the elected role and in an appointed role.
All right. Secretary Gray, we appreciate you coming very much.
Bill.
All right. Everybody, we'll be back. We will wrap up Kentucky Newsmakers with a word about next week's show in just a moment. We certainly appreciate you being along for this edition of Kentucky Newsmakers. One of our guests next week scheduled to be Republican candidate for Congress, Deanna Gordon. And we remind you, you can get all the latest on WKYT News on air and online, and hope you make it a good week ahead.